Hi, everyone. Thank you so much, Mr. Secretary. We really appreciate it, and we're gonna bring you back up on stage right now, if that's all right, for a conversation, along with Dr. Jane Muncke, Dr. John Warner, Dr. Marcus Eriksen, and Dr. Leo Trasande. Why don't you squeeze through? Sorry about that. And then you're right here, sir. Sure. You can be right here, Jane.
Good to meet you. Pleasure. Good to meet you.
Thank you so much, sir. We really appreciate your remarks. And we're really excited for this next part of our program, where we're going to be introducing you to some of the top scientists in the world that are dedicated to human health. I'm going to start off just by introducing our panelists and then give them an opportunity to talk with you. So to my left, I'd like to introduce Dr. Jane Muncke. She's an environmental scientist who trained in environmental chemistry and environmental toxicology at ETH Zurich, the same university that Albert Einstein went to 100 years ago. Jane is the co-founder and managing director and chief scientific officer of the Food Packaging Forum, an independent charitable scientific organization in Switzerland. She works on chemicals of concern in food contact materials and on the environmental impacts of food packaging. Jane is a member of the Scientists Coalition for an Effective Plastics Treaty. To her left is Dr. John Warner, who's worked in industry and academia and entrepreneurship and government policy. He has hundreds of patents and dozens of successfully commercialized products based on his inventions. He's one of the founders of the field of green chemistry, the mechanistic science that teaches us how to make products safe for humans and the environment. To his left, Dr. Marcus Eriksen is a scientist and co-founder of the Five Gyres Institute, having sailed all the world's oceans to research plastic pollution, but now focuses on biomaterial solutions that leave no legacy of waste. And finally, Dr. Leo Trasande is an internationally renowned leader in environmental health. His research focuses on the impacts of chemicals on hormones in our bodies. He also has led the way in documenting the economic costs for policymakers of failing to prevent diseases and of environmental origin proactively. He is the Jim G. Hendrick, MD, professor of pediatrics, and directs the Center for the Investigation of Environmental Hazards at NYU's Grossman School of Medicine, and he serves on the faculty of NYU's Wagner School of Public Service. So we're gonna start with Dr. Muncke, and if you could let the secretary know what you believe is contributing to the childhood chronic disease epidemic and how you believe HHS can help, and any comments you may have on the secretary's remarks.
Thank you, Dave. Oops, that's on. Okay. Good morning. I'm a foreigner, so I almost feel like I don't have any business telling you what to do, but I appreciate the opportunity. I've been working on food contact chemicals for 18 years now, and we see an increase, as you mentioned in your excellent comments, of chronic diseases, non-communicable diseases. And while we know that these diseases are multifactorial, there's not one single smoking gun, right? Otherwise, it would be easy to address them. I do strongly think that chemicals contribute to at least some of these diseases. We know that from robust toxicological data, from epidemiological studies. And so it does make sense to look at the places where we are exposing people to known hazardous chemicals, synthetic chemicals, where we can actually make a change. And food packaging, food contact materials definitely are one of those exposure sources. So the work we've been doing at the Food Packaging Forum, which is an independent scientific organization, we're a charity, we compile lists of these chemicals. They didn't exist when I started. So we identified that there are 15,000 food contact chemicals. The vast majority of those actually have no hazard data. They've never been tested. They're on the market. Companies put food into these materials.
Is it 15,000, all of them used in this country?
No, it's more than that, actually. Because when you make a plastic, or you make a printing ink or can coating, it's very complex, aggressive chemistry. And you have a lot of reaction byproducts, which will also be in the material, in the finished product, and which can also leach out. So the problem is bigger than just the chemicals that are being used to make these materials. And even the ones that are being used to make the materials don't have thorough testing for their hazard properties. Now, what FDA does, and this was introduced under the Clinton administration, they basically waive any toxicological testing if exposures to certain chemicals are below a threshold. And that threshold is 1.5 part per billion in food. It's 1.5 microgram per kilogram food. And if a company estimates exposure to be below that, you don't need to test those chemicals. So I'll just let that sink in. And then we have 15,000 chemicals. Some of these are active, cause harm at levels way below 1.5 part per billion, like BPA, for example. That's the safe threshold that the European Food Safety Authority set for BPA is 1.5 part per trillion. You know, so it's 1,000 times below where FDA does not require any more testing. And then we have mixture toxicity and so on. So I really appreciated your comments to tackle those food contact chemicals, especially because exposure during fetal development, during the womb, and the first 1,000 days of life is exquisitely sensitive to these chemicals. And if we can get those chemicals not only out of the food for children, but out of the food for mothers and fathers, I think we can have a good chance to reduce at least some of those chronic diseases. Thank you.
Thank you.
Thank you, Jane. Next up, Dr. John Warner. Could you give us your opinion on what's the current cause of current childhood chronic disease and some reflections on the Secretary's remarks?
Thank you for your remarks. I'm very excited for the future. From my perspective, my big thing
I think you need to.
my big issue is that to get a degree in chemistry worldwide, to get in any university, no university requires a chemist or a material scientist to learn about mechanisms of toxicity, mechanisms of environmental harm. It is absent from our training. So when they graduate and they go work for industry, industry wants safe technologies, but the people inventing the materials have zero training. It's actually astounding when you think about it. The only people in the world who operate at the molecular level to create a new chemical entity, for some reason, and not an epic battle of good and evil, it's just a weird evolution of the way we do things, they don't learn anything about mechanisms of hazard. So how can we ask people to invent future things that are non-toxic if they don't know what makes something toxic? And so the field of green chemistry is a science where we're trying to get universities, any university that trains a chemist or material scientist should have as part of the required curriculum a small piece just to train the scientist. How do you anticipate, if you're going to invent a new material or a new product, how do you anticipate its potential for harm? And it's not a panacea that's going to solve all the problems, but maybe we can start inventing, because all the knowledge that the people here are learning aren't even heard by the people inventing the technologies. We live in two different universes. So green chemistry tries to bring those universes together so that Jane is inventing the textbook that I, as a chemist, need to read so that I know how to make the better products. But most chemists have never heard of her work, and we need to change that.
It's interesting. I'd love to know if the schools that teach chemistry get substantial NIH or HHS funds, because in that case, we have leverage. One of the things we're doing now with medical schools is there's almost no medical schools that have nutrition courses. And so they're taught how to treat illnesses with drugs, but not how to treat them with food or to keep people healthy so they don't need the drugs. There's other gaps in their training that we're going to address. But one of the things that we'll do over the next year is to announce that medical schools that don't have those programs are not going to be eligible for our funding, and that we'll withhold funds from those who don't implement those kind of courses. So we could do the same thing with chemistry schools. I'd love to talk to you about that.
I think that's a perfect, that if someone's receiving funds to invent new materials, have them explain how they're going to anticipate that they're not making toxic materials.
Yeah.
And if they don't have an infrastructure to do that, good.
And I'll comment on what you said, Doctor, is that one of the big issues that we have at NIH is there's been a systematic suppression of studies of toxic chemicals, and particularly their links to chronic disease. And what we're seeing more and more is that the chronic disease epidemic is multifactorial, but there's something in common, which is challenges to mitochondrial health. And each exposure with many of these chemicals is a cumulative exposure, and it challenges the mitochondria, which are the power centers of the cell. And so all of these exposures, our kids are now swimming around in a toxic soup, and their mitochondrial function is challenged from the day they're born. Even before that, it's challenged in the placenta with all these exposures, of which we don't know anything about. And unfortunately, prior to this administration, the NIH has systematically suppressed that science. So if a science wanted to study that, he would not get funding. And scientists who even tried to publish on it would have through NIH pressure and through pressure from pharmaceutical industry and mainly pharma, because they really run the big journals like JAMA and New England Journal of Medicine and the other big journals. They were able to get those studies retracted or to get them so that they just couldn't be published in a high gravitas journal. And we're going to remove now a lot of the taboos on studying those, encourage scientists to study them, and we're going to do it systematically. I doubt if we can study 15,000 science substances over the next 4 years, but we want to take the most impactful ones and do really thorough studies on those, and then let the marketplace redress the problem. And I'll give you an example. When in federal courts, there's a law called the Daubert, there's a rule called the Daubert rule, there's equivalent rules in state courts. And the Daubert rule says you cannot sue somebody for an exposure arguing that it caused your injury unless there is a substantial body of science that supports that. So you can't say that, Coca-Cola caused my schizophrenia unless there are a range of studies, epidemiological studies, bench studies, animal studies, observational studies, a whole range of studies that support that. So if it's not mainstream, it's at least edging toward the mainstream. And before every trial of that kind, there's a Daubert hearing where the judge makes a determination about whether to allow that argument to go to the jury. And he or she has to make an independent assessment of whether there is sufficient body of science to back this claim in order to allow it into court. Once that science exists, the marketplace redresses the problem. And that's what I did with the Monsanto case. There were about 21 studies, and they were a good mix of studies that showed that Roundup was linked to non-Hodgkin's lymphoma. Roundup is linked to a lot of other bad things too, including endocrine disruptors and other cancers and non-alcoholic fatty liver cancer and many, many others. But at that time, there was not sufficient science to be able to surpass the Daubert threshold. Once you have the science out there, then the marketplace, through the plaintiff's bar, can redress these chemicals, so you don't even have to go through a legislative process, because the chemical companies, the big food companies, and others have a lockhold on Congress. So a lot of these things you just can't regulate, but you can redress them to the market. And one of the things that we're going to be doing, we're already doing over the next 4 years, is to look very carefully at the etiology of chronic disease, to link them to specific culprits, and then to allow the marketplace to redress the problem. And you know, if there are chemicals that we should be studying that you think are high priority, I'd like to hear them, and we will get it done.
I can send you lots of lists.
Not too many. We got a $46 billion budget, and we distribute that money at NIH to about 300,000 scientists in 60,000 grants. And those scientists are from research institutions all over the country and all over the world. But there's a limited number of them that you can study, you know, in 4 years. So I want to identify the worst culprits, the most likely culprits in aggravating and amplifying the chronic disease epidemic, and make sure we have really good science happening on those. And we are, the first time in history, we are going to replicate all of our studies. So about 20% of NIH's budget will go to replication. There's a lot of bad science out there because scientists are under extreme pressure to publish, and if they have a null hypothesis, they don't get published. And a null hypothesis is science, right? We want to read it. But if you have a null hypothesis, you can't get it published. So scientists are under tremendous pressure to find a positive hypothesis in all of their studies. And if they know that study is never going to be replicated, that the public is not going to have access, that other scientists aren't going to have access to their data sets, then they won't do it. So we're going to make sure that every data set is available through data sharing agreements to other scientists, that every study is replicated, and we're going to have real science for the first time rather than what we have now, which is not science. It's largely the science that has come out of HHS over the past 20 years is, I'd say, mainly industry propaganda rather than real science. And we're going to do real science.
Marcus.
If I just jump in, yeah. You said something really important a second ago about exposures before you're born. I've been an ocean plastics guy for most of my career, and I can tell you in the middle of the ocean, when we look at plastic pollution, we find forever chemicals on those items. As far from land as you can get on the planet, we're finding things like PCBs, small amounts of DDT, flame retardants. Now, before my wife and I had our daughter, she had her blood serum analyzed and found those exact same 3 components in her blood. She found flame retardants, DDT, and PCBs in her body. And you know, I gave a talk this morning talking about bringing it home, bringing it from the oceans right to in our homes, in the packaging that's holding the food that we're giving to our children. And we think of where's the burden of proof? It's on the companies who are putting these chemicals into the packaging, whatever properties they want for their packaging, inks and dyes and laminates and glues and so forth. But the burden of proof should be on the companies. The idea of no data, no market. What are some of the policy levers that we can use to ensure that companies have really good data on the safety of this chemistry before it goes into the packaging that's holding the food we give to our kids?
Well, I'll just give you an example of what, of the corporate strategies, which is I brought the first case against PFASs, which was a case I brought in Ohio and West Virginia, and representing about 10,000 people who had been poisoned by a DuPont facility there and had extremely high levels of PFAS in their bloods, which is a forever chemical. It's used as a flame retardant, but many other uses, a glue, et cetera. And they made a movie about that film, Mark Ruffalo did, called Dark Waters, about my trial. And the companies agreed to remove those chemicals, but what they did was they simply took the molecular structure of PFAS, added a new molecule, and then they had a new chemical, which are not tested. And the reason they're not tested is because of the GRAS standard, which we're changing. The GRAS standard is a standard that says generally recognized as safe. And it was originally, when FDA originally was created in the 1920s because of Upton Sinclair's book, The Jungle, to deal with adulterated foods, to keep microbes out of foods. And it started paying attention to chemicals in the late 1940s. And it decided that Congress decided that FDA should now start regulating chemicals and additives in our food and ingredients in our food. But they wanted to create, there are some ingredients that are so well established. They've been around for thousands of years, like bread and wheat and flour and sugar, et cetera, dairy and eggs. And they said that we don't want to have to retest those kind of things. And so we're going to have a standard for ingredients like that. We're going to say they're generally recognized as safe and you don't have to test them. Everything else you have to test. But industry captured the agency. And industry captured the GRAS standard. And so today, the GRAS standard is applied to every ingredient in food, every new chemical that a company proposes to add to food. And that's why in this, it's automatically rubber stamped GRAS. Even if the chemical was unknown to science, was created in a lab yesterday, it is still stamped generally recognized as safe. And that's why we have 10,000 known ingredients in our food. That's why I was interested in your number, because I've been using and, read the number 10,000 for many years. And the Europeans only have 400 chemicals because they don't have the GRAS standard. They have a rule that says that before you add a chemical to a food, it has to be proven to safe. Our system it's assumed safe until proven guilty, and that proof seldom arrives. And so we're going to change the GRAS standard now so that every new food additive has to be tested. And then we're going to go back and test as many as we can of the existing additives and get rid of the categories, not just, PFAS 0.2 and PFOAs and all the other, forever chemicals that are just these tiny molecular changes in them. We're going to get rid of whole categories of chemicals in our food that we have good reason to believe are harmful to human health. But that's the answer to your question, is the big hole, the loophole that you can now drive a fully loaded train of chemical train through is the GRAS standard. And that's why, one of the reasons our kids are so sick.
Thank you, Secretary. And Dr. Trasande.
Mr. Secretary, I'm really delighted to see your leadership in addressing GRAS and addressing so many elements that have made our food chemical safety system fundamentally flawed at this point. I had the privilege of leading the American Academy of Pediatrics Food Additive Chemical Statement back in 2018, and many of the items that you documented in your presentation follow that playbook. I'm really just delighted. I was worried that statement would gain electronic dust, frankly, over time, and so I'm glad to see that it's been picked up. So that's wonderful. I wanted to build on a point that you made about nutritional education in the medical school curriculum. As a pediatrician, I'm gobsmacked that we still have a curriculum that only has 1 to 3 hours of environmental health in it. And you probably know in your healthcare provider experience that if a healthcare provider doesn't know how to advise about something, let's say, mercury in the fish or pesticides in food or PFAS, what have you, they don't like to say, I don't know. So they'll say, well, it's not a big deal. It's nothing to worry about. And so one of the fundamental problems as in the medical school curriculum is that we don't teach about these hazards and provide safe and simple steps that are out there. They don't have to break the bank. They don't require a PhD in chemistry to reduce exposure. And we need better integration of environmental health in that medical school curriculum. That will double the benefits of all the steps that you're taking to address chemicals in the food supply. Thank you very much. We're really excited to be working with you.
I would appreciate your advice on anything else that I've met with the leading medical schools, and they are they are the opposite of resistance. They want to embrace this, And we're going to give them incentives to develop really good curriculum on nutrition. But we're also we have a carrot and a stick that if you don't do it, you're not going to get NIH funding. And I would love to do the same thing for the chemical foods. That's something that the things that I'm most interested in are things that I can do with the stroke of a pen without having to go through regulations, although regulations aren't that hard for us. When I was litigating, the average regulation took 7 years. And so if a president put it in the second year of his term, it was pushed into the next administration, which a lot of times would just cancel it. And but we've figured out, I've got really good attorneys working for me who are absolutely aligned and committed, and we figured out ways that we can do regulations in 90 days. And for everything that we want to do it for everything that we can. So, we want to send a barrage of new regulations into the Federal Register to, again, realign the American economy, the economic rules that provide the guardrails for our prosperity. Realign those with public health so that if you want to do well, you got to do good. You can get rich by doing good things for America rather than getting rich. Making yourself rich by making the rest of us poor. Raising standard of living for you and your company by lowering quality of life for other Americans. We want to get rid of all the perverse incentives and return to an aligned system where the economy is serving the public welfare.
And we should all get behind, frankly. So I'm really delighted, and I was really proud to hear that you really are supporting research in particular into the effects of these toxic chemicals. I would agree with you that chemical and environmental factors haven't been a strong part of the NIH portfolio in the way that they ideally would. There is infrastructure, I want to emphasize already, to look at chronic diseases in kids. In particular, I wanted to just highlight the environmental influences on child health outcomes program. Currently sits in the NIH Office of the Director. That birth cohort of 64,000 kids has biological samples of every type you can imagine available to literally pull and look at chemicals of concern in the food supply. And it's just a matter of supporting that ongoing infrastructure as well as the broader National Institutes of Environmental Health Sciences portfolio to really attack this problem and provide the best independent science to inform the actions that you're suggesting. So thank you.
Yeah, I don't know of that study. I'm really interested in it because right now, one of the things that we're doing is NIH, it's so crazy there that when I asked, we want to do a bunch of studies to find out the etiology of the autism epidemic and of other chronic diseases, and we asked CDC to provide us the biggest data link on vaccines was Vaccine Safety Data Link. The division that was in charge of that refused to do it, and to this day they're refusing a lot. A lot of those people are leaving the agency. But the CMS data is also siloed, and they sell it to other subdepartments of our agency for a lot of money. And so we are breaking down all those walls. We're going to private industry, and we're finding the best databases out there, and we're going to get the best information we can about the health of the American public. We're going to digitalize it, we're going to depersonalize it, and we're going to make it available for independent scientists all over the world so that we can actually do real science and get real answers. There were so many crazy studies that were being funded by that agency that just made no sense in terms of our public health. And those studies we're canceling, and we're reassigning that money to go to determine the most important thing for parents in our country, for the American people, which is to find out what's making them the sickest people in the world. We have the highest chronic disease burden of any country in the world. We have 60% of our people are chronic disease. And during COVID, we had the highest death rate of any country on earth. We had 16% of the COVID deaths in this country, and we only have 4.2% of the world's population. Why did we do worse than any country in the world when we have the best technology and the best healthcare system? And when we asked CDC about that, they said it's not our fault. It's because Americans are so sick. And I said, well, that is your fault. And they said the average American who died from COVID had 3.8 chronic diseases. And one of the reasons we were dying faster than anybody else is because we have the highest chronic disease burden of any country in the world. And, we got to end that. We got to make Americans healthy.
So maybe if I can just add to that, another sad first for America is the consumption of ultra-processed food. So 58% of the diet in the US, average diet, consists of ultra-processed foods. And what we are working on now is trying to identify how many and which food contact chemicals leach during processing and from the packaging, and which ones actually contribute to the health impacts that we're seeing from epidemiological studies, and where the US has gold standard scientific data sets from NHANES, which is a wonderful biomonitoring program. And those can be used, these data sets can be used to tease out, to prioritize which food contact chemicals actually are contributing to these drivers of disease. And then we could easily work with the biosamples that Professor Trasande has and other colleagues to then test these hypotheses. And that's how we can filter down that big list of 15,000 to maybe a couple dozen, and then really target those. So that's one way to move forward.
And that's important, and it's important then to get that information out to the American public. And we're going to do that by starting basically a dictionary of all these different chemicals so that private industry can then come in and develop apps. And Patrick Soon-Chong has a really great app that you can put any barcode of any product in any American supermarket, and it will go through all the chemicals and exactly what the impact is. I use an app, and my wife uses an app called Yucca that I'm sure a lot of you know about. You just scan any product, and it gives you really good information on that product. But we want to create an ecosystem where industry will come up with these kind of apps. I met with the health minister of Singapore yesterday, and of Indonesia, but they're using a labeling system that's a very simple labeling system. And it tests for only three things. It tests for sugars, for sodium, and for bad fat, which all have synergistic effects on mitochondrial health and metabolic health. And they have succeeded in dramatically improving the health of their public. Singapore spends about $3,300 per capita on health. And they have one of the longest lived populations in the world. Their average longevity is 84 years old. We spend $12,000, about more than that, about $12,500 per capita on our health in this country, and our lifespan is now at 79. 20 years ago, we were equivalent to the lifespans of the European countries, the EU averages, and we had one of the longest lifespans in the world. But all of them have added 6 years to their lifespan, and ours has stayed static. So now we're 6 years behind others. And one of the most dramatic outcomes, and they did a kind of a natural experiment in Australia where they did labeling, and they dramatically improved public health. So when the public knows what they're buying, they make good choices. And that's one of the things that we're going to do at FDA is we're going to create labeling requirements and get them on all the products so that parents can make good decisions for their kids.
Well, thank you, Mr. Secretary. Thank you, Dr. Muncke, Dr. Warner, Dr. Eriksen, and Dr. Trasande. We are at time, and I know we could keep going and going, but I just, on behalf of the OPLN and Atlantic Packaging, we want to thank all of you for coming on stage today. Thank you so much for coming today. And if you could join me in a round of applause. Thank you, sir. Really appreciate it.
Can I have the Zoom go this way?
Hi, everyone. My name is Rachel Ryan. I am a technical program lead here at OPLN. Thank you so much for joining us for such important conversation.